The coronavirus, which appeared in China in December 2019, is now circulating in France and infecting more and more people. What are the risks for pregnant women? The epidemic of COVID-19, the name of the disease caused by SARS Cov-2, has reached stage 2. In other words, the virus is circulating on French soil. A very worrying situation for pregnant women. What are the risks to their health and that of their unborn child, if they are infected with this virus? The SARS Cov-2 coronavirus appeared in late December in China. Few elements therefore exist for the moment on its consequences on pregnancies. However, doctors at Wuhan Hospital said that expectant mothers could pass it on to their babies. They came to this conclusion after a child born to an infected woman tested positive for the coronavirus a few hours after his birth, on February 2nd. The newborn had no fever or cough. On the other hand, he suffered from shortness of breath. Questioned by CCTV, the Dr. Zheng Lingkong of the Hospital of Wuhan calls with caution. This fact shows us that one must be vigilant vis-a-vis the transmissions going from the mother to the child. Professionals do not yet have enough perspective to know the effects of the SARS CoV-2 virus on a pregnancy and a fetus. However, 2 studies carried out during other coronavirus epidemics allow researchers from the Research Institute for Development and the University of Aix-Marseille to warn future mothers. These viruses can have serious consequences for the health of the mother and baby. A first study had followed 12 pregnant women who contracted SARS Cov between 2002 and 2003. 7 expectant mothers were in the first trimester of their pregnancy. 4 of them then had a miscarriage. The remaining 5 had reached the second or third quarter. Intrauterine growth retardation was observed for 2 of these women. 4 gave birth prematurely, including 3 due to the patient's state of health. In addition, 3 women died. Another research on 11 women infected with MERS-CoV. 6 newborns were placed in care attentive to their birth, 3 others were born prematurely because of the worrying state of health of their mother, and 3 patients died. SARS-CoV-2, responsible for COVID-19, is very close to the MERS-CoV and SARS-CoV coronaviruses. Scientists fear that the disease could lead to complications during pregnancy. They recommend in an article published in the Lancet journal a systematic screening at 2019 nCoV. They also call for prolonged medical follow-up for the mother and baby if an infection is confirmed. How to protect yourself from coronavirus. Future mothers should protect themselves from the SARS CoV-2 coronavirus. It is recommended to follow these simple actions to avoid contamination. Wash your hands very regularly. Cough or sneeze into his elbow. Greet without shaking hands, avoid kissing, use disposable tissues. Wear a mask when you are sick.